Hello, my name is Darlene Sampson, and welcome to my collaboration and reflection video for NURS-4010, Leading People, Processes, and Organizations in Interprofessional Practice. Interpersonal collaboration is an important piece of the healthcare organization. It allows for patients and practitioners to work together towards the best healthcare outcome for the patient. Reflective learning, on the other hand, is the process of gaining new insights from our past and present experiences. Reflection is important as it helps develop critical thinking and problem solving by allowing nurses to analyze their past actions to help guide future decisions and behavior. For this presentation, I will reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes. I will include ways in which reflective nursing practice can help build a better understanding of past experiences to improve future practice decisions. This experience that I will share is regarding a situation that is commonly seen in a skilled nursing facility. One of the most common incidents in nursing homes are falls. Falls could result from a variety of different reasons. It could result from a patient's clinical impairment, poor environment, or lack of timely assistance. In this story that I will share, I am the charge nurse RN at a skilled nursing unit, taking care of a confused and agitated patient who is at high risk for fall. This patient is diagnosed with schizoaffective bipolar disorder, along with other comorbidities, including diabetes and seizure disorder. This patient is on several antipsychotic medications, benzodiazepines, and diabetic medications. On her good days, the patient is asymptomatic with no psych issues. She is alert and oriented times 2 to 3, able to communicate needs, calm, and cooperative. Patient is compliant with her medications and treatments. However, there are periods when she would start to elicit positive symptoms of schizophrenia and bipolar disorder, including disorganized thoughts, physical and verbal aggression, and combativeness. One day, she was starting to show behavioral symptoms of confusion and agitation and physical symptoms of having unsteady gait. She was at a high risk for hurting herself and staff, as well as having a fall that can lead to more complications. In this situation, interdisciplinary collaboration was of high importance. Astute assessment is important in my part as an RN. I reported the changes to her primary physician, noting her physical presentation, vital signs, changes in her current behavior, and her medication compliance. I asked for a recommendation for lab work as her confusion can be a sign of UTI or any other underlying condition. I also reported changes to her psychiatrist, reporting her current presentation, asking for medication review or potential medication adjustments. Right away, I established a one-on-one monitoring for the patient with a CNA. The CNA is also to assist with ADLs such as toileting, bathing, and feeding. LVNs are assigned to assist with medication administration as well as glucose checks. The social services are contacted for proper placement for this patient to a room closer to the station to allow better visualization of the patient. The DON and ADON are notified regarding the patient's current status. All the unit staff were in service on fall precautions, including placement of fall landing mat, one-on-one visual check, placing bed in lowest position while patient is in bed, having call light within reach, anticipating patient's needs, toileting at least every 2 hours, and monitoring for pain or discomfort. In the end, the patient's lab came in and reviewed with noted increased ammonia levels, which resulted in her increased confusion. Additional lactose was added to her medication regimen. Patient's outcome was positive, noting her cognition eventually improved. Patient did not have a fall under staff's close supervision and initiated fall precaution protocol. Reflective practice allowed for this nurse to apply what I have learned from my past experiences dealing with similar psychiatric and fall risk patients. Reflection leads to a more thoughtful, calm, and critical approach towards the situation. Collaborating effectively with other IDT produced the desired outcome for the patient to return to baseline health condition and prevent fall-related injuries. Next, I will identify how poor collaboration can result in inefficient management of human and financial resources. According to Zubkov et al. In 2018, Quote, falls are the most common cause of fatal injuries among older adults and one of the top sentinel events reported to the Joint Commission. End quote. If there was poor collaboration between the healthcare team supervising this patient's care, the patient could have ended up causing harm to herself and others due to her agitated behavior. Furthermore, the patient could have ended up having a fall that could result in other injuries such as fractures, hematoma if she would have hit her head from the fall, and other graver complications. This could result in the patient having to be transferred to the hospital, leading to increased health risks and healthcare costs. Early and preventative treatment coming from all facets of the IDT team resulted in the patient's safest healthcare outcome. Now I will share the best practice leadership strategies from the literature that would improve an interdisciplinary team's ability to achieve its goals. In the journal article from the American Journal of Nursing written by Ocker et al. In 2021, it is concluded that an interdisciplinary collaboration approach with evidence-based practice and root cause analysis is effective in reformulating a fall prevention program for the adult behavioral population in an inpatient setting. Behavioral patients pose a different risk for fall and safety due to being on psychotropic medications, limited ability to follow instructions, and limited orientation to reality, and episodes of agitation. In the study conducted by Ocker et al. In 2021, at a behavioral unit, a quality improvement team was created consisting of the behavioral unit clinical manager, lead clinical nurse, executive director of behavioral sciences, the chair of the organization's fall committee, the manager of accreditation and patient safety, and the coordinators of accreditation and patient safety. The QI team was tasked with conducting a root cause analysis of the major falls that took place in the unit from October to December 2016, so a fall prevention program can be redesigned. According to the Agency for Healthcare Research and Quality, root cause analysis is a systematic approach to examine adverse events so that faulty systems and processes can be identified and corrected. This allows for a systematic change that can lead to avoid adverse events such as falls and improve patient outcomes. Finally, I will identify best practice interdisciplinary collaboration strategies to help a team to achieve its goals and work together more effectively. Creating a QI or Quality Improvement Committee is an important strategy to allow individuals to collaborate in carrying out improvement efforts. According to Rowland et al. In 2018, an effective team must consist of a diverse group of representatives along with the end user or recipient of care, which is the patient, if possible. A quality improvement plan is created starting with a SMART goal, which is specific, measurable, attainable, relevant, and time-bound. In addition, a good QI plan must include a statement for the mission, a plan for scheduled meetings, and a plan on how to acquire and evaluate the data. With a quality improvement team approach, adverse events including falls can be reduced in a facility.